This is part 2 of the female reproductive system, A&P. Hormonal control. So the hypothalamus, it secretes a releasing hormone that stimulates the anterior pituitary gland to secrete two gonadotropins, which are FSH and LH. The FSH and LH then stimulate the ovaries, causing them to secrete estrogen and progesterone. So here's a diagram here. You have the hypothalamus is going to send the releasing hormone to stimulate the anterior pituitary gland to secrete LH and FSH. And so it targets the ovaries, and from there, the ovaries, they produce estrogen and progesterone. And so estrogen, it deals with the follicle and secondary sex characteristics. It also stimulates the proliferative phase of endometrial development, which we'll talk about in a few minutes. Then you have progesterone. This is the corpus luteum, and it stimulates the secretory phase of the endometrial development. So you have two reproductive cycles. You have the ovarian cycle and the uterine cycle. So first, the ovarian cycle, it contains the follicular phase and the luteal phase. So let's break that down. So you have the ovarian cycle. It runs 28 days. This is also your menstrual cycle. So day 1 to day 14 is the follicular phase. So this is where estrogen dominates. Estrogen stimulates the maturation of the ovarian follicle and helps build up the uterine lining in the first half of the uterine cycle, which is days 1 to 14. And the follicular phase ends when a sharp rise, called a mid-cycle surge, of your LH on day 14. So in the follicular phase, that just means that you have your period on day 1 that lasts about 5 days. And then so your follicles, they begin to start building up. On day 14, this is known as ovulation. This is where the egg is released. Next, you have the luteal phase. This is day 14 to 28. And progesterone dominates this phase and is known as the hormone of pregnancy. So if an egg is fertilized, you have the corpus luteum. And then if the egg is not fertilized, it's called the corpus albicans. And this is secretion of estrogen and progesterone. It declines. So when it declines, that's going to stimulate the anterior pituitary gland to say, let's go back. There was no pregnancy happening, so we're going to go back to day 1. So those are the two phases, follicular and luteal. Next, you have the uterine cycle. This is the menstrual cycle. The uterine cycle consists of changes that occur in the endometrium over a 28-day period. Estrogen and progesterone secreted by the ovaries cause the endometrial changes. And so this cycle has 3 phases: the menstrual phase, proliferative phase, and the secretory phase, secretory. So to break that down, your first phase is menstrual. This is bleeding. So this is known as having your period. It begins on the first day and continues 3 to 5 days. The functional layer of the endometrial lining and blood leave the uterus through the vagina as menstrual flow. So your next phase is the proliferative. It begins with the end of the menstrual phase. This is the repair and regrowth of the inner endometrial lining. And the lining grows because of estrogen. So the lining becomes thicker and acquires additional blood vessels. So menstrual, you have your period. Proliferative, this is where it's repairing and regrowing. And then the last one is your secretory. This is caused by the secretion of progesterone by the corpus luteum. Progesterone causes the endometrial lining to thicken and become more juicy, thereby forming a nutritious environment, awaiting the arrival of a fertilized ovum. So with this phase, it's preparing to have a baby. So it's going to thicken and provide nourishment and enough lubrication. So those are the 3 phases. So implantation, keeping the corpus luteum alive. So soon after fertilization, the egg implants in the uterine lining. Some of the cells at the site of implantation in the uterus secrete a hormone called HCG. Blood carries HCG from the uterus to the ovary, where it stimulates the corpus luteum. Deterioration of the corpus luteum is prevented by HCG. So the life of the corpus luteum is prolonged for 11 to 12 weeks by HCG, and so the placenta can take over as the major estrogen and progesterone secreting gland. So this is the hormone that it gets picked up if you were to do a pregnancy test. So it's going to tell the body that you're pregnant so that you don't go through the menstrual cycle again. So let's review. So the hormones, the pituitary gland, it stimulates the secretion of FSH and LH, which stimulates the ovaries, that stimulates estrogen and progesterone. You have 2 reproductive cycles, the ovarian and uterine. So the ovarian cycle, it contains the follicular and the luteal phase. The follicular phase is day 1 to 14. Estrogen is your main player, and your follicular cells are growing. Then in the luteal phase, it's day 14 to 28. Progesterone is your main player. You have the corpus luteum, that is the fertilized egg, and the corpus albicans is the unfertilized egg. Your uterine cycle, it consists of 3 phases. The menstrual, which is like having your period. Proliferative is the repair and growth. Estrogen causes the inner lining to become thicker. And secretory, the progesterone causes the endometrial lining to thicken and become more juicy to prepare the environment for the fertilized ovum. So you have a few terms: menarche, menses, and menopause. Menarche is the very first period. Your menses is your menstrual period, and menopause, it's also called the change of life or the climacteric, and it is the cessation of periods. So let's move on to female breast and lactation. So your breast, they contain the areola. This is the pigmented skin that surrounds the nipple. And then you have mammary glands. And so inside each gland, it contains 15 to 20 lobes. And each lobe contains many alveolar glands and a lactiferous duct. So your alveolar glands, they secrete milk, which is carried toward the nipple by the lactiferous duct. And then you have suspensory ligaments that help support the breast. So hormones of lactation. Lactation is your milk production. And lactation requires prolactin, which is a hormone secreted by the anterior pituitary gland. So high plasma levels of estrogen and progesterone by the placenta inhibit prolactin secretion during pregnancy. So after pregnancy, those hormones decrease, allowing prolactin to be secreted. Milk production takes 2 to 3 days to begin. So in the meantime, you have the colostrum that's produced. Then you have oxytocin, which releases the milk from the breast when the baby suckles. And the suckling and oxytocin release is called the milk letdown reflex. Next is methods of birth control. You have barrier methods. These prevent sperm from entering the female, so such as condoms, diaphragms, spermicidal creams, foams, and jellies. Hormonal contraceptives, they prevent ovulation. This is your birth control pill. You have surgical methods such as the vasectomy for the men and the tubal ligation for women. You have the IUD. It stimulates the uterus to prevent implantation of the fertilized egg. You have behavioral methods such as abstinence, not having sex at all, or the rhythm method, which is also the time coitus, and this is where you avoid sex during ovulation. And then you have emergency contraceptives such as Plan B pill. So other medical terms, you have dyspareunia. This is painful intercourse. Endometriosis. This is a condition in which The endometrial tissue grows in other parts of the body, particularly within the pelvic cavity. And structures most commonly affected are the intestine, fallopian tubes, and ovaries. You have episiotomy. This is the incision into the perineum, the area between the vagina and anus, and this is done during delivery of a baby to prevent the tearing of the perineum. Leukorrhea, it is an abnormal white to yellow vaginal discharge. Mastitis, this is inflammation of the breast. Amenorrhea, it is absence of menstruation. Dysmenorrhea, painful or difficult menstruation. Menorrhagia is excessive bleeding. Metrorrhagia, bleeding from the uterus at any time other than normal menstruation. And salpingitis is inflammation of the uterine or fallopian tubes. So now that you've gone through part 1 and 2, let's test your knowledge. I have a few questions here. Let's start. So the corpus luteum dies and becomes this non-secreting structure, also known as the white body. Corpus albicans. Skin-covered muscular region between the vaginal orifice and the anus. Perineum. Implantation of the embryo occurs here and is also called the womb. The uterus. Fertilization occurs here. Fallopian tubes. Mons pubis, labia, and clitoris, also called the vulva. These are your external genitals. Parts of this organ are the fundus, body, and cervix. The uterus. Layers of this organ are the epimetrium, myometrium, and endometrium. The uterus. The membrane that partially covers the vaginal opening. The hymen. The term for an immature egg. Oocyte. Target glands of FSH and LH. Ovaries. Mature ovarian follicle. Graphin cells. Ovarian structure that primarily secretes progesterone. Corpus luteum, called oviducts or uterine tubes. Fallopian tubes. Promotes the maturation of the egg and development of the female's secondary sex characteristics. Estrogen. Hormone that is primarily secreted by the ovaries during the follicular phase of the ovarian cycle. Estrogen. Hormone that is primarily secreted by the ovaries during the luteal phase of the ovarian cycle. Progesterone. A surge of this hormone immediately precedes ovulation. LH. Classification of FSH and LH. Gonadotropins. Hormone that stimulates the corpus luteum during early pregnancy and prevents its deterioration. HCG. Ovarian hormone that dominates the secretory phase of the uterine cycle. Progesterone. Ovarian hormone that dominates the proliferative phase of the uterine cycle. Estrogen. Composed of the menstrual, proliferative, and the secretory phases. The uterine cycle. The ovaries primarily secrete estrogen during this phase of the ovarian cycle. Follicular phase. The ovaries primarily secrete progesterone during this phase of the ovarian cycle. Luteal phase. Ejection of a mature egg at mid-cycle. Ovulation. Okay, multiple choice. If fertilization does not occur, the corpus luteum A secretes progesterone, B secretes HCG, C forms the corpus albicans, or D forms into a placenta. C forms the corpus albicans. When is fertilization most likely to occur? A, immediately after menstruation, B, immediately before menstruation, C, around ovulation, the mid-cycle, or D, day 28. C, around ovulation. With which events is the LH surge most associated? A, implantation, B, ovulation, C, ejaculation, or D, menopause? B, ovulation. Ovulation, A, normally occurs on day 14 of a 28-day cycle. B, is caused by the secretion of HCG by the trophoblastic cells. C, causes the release of hormones that form the Graafian follicle, or D, occurs on day 28. A, normally occurs on day 14 of a 28-day cycle. The luteal phase of the ovarian cycle, A, is dominated by progesterone, B, requires HCG, C, occurs only in the pregnant state, or D, immediately precedes ovulation. A, is dominated by progesterone. Which of the following is true of the process of meiosis? A, occurs in every cell in the body except oocyte and spermatogenium. B, reduces the chromosome number from 46 to 23. C, increases the chromosome number from 23 to 46. Or D, occurs in the ovum but not in the sperm. B, reduces the chromosome number from 46 to 23. Which of the following is true of menopause? A, usually occurs in late 20s and early 30s. B, is always accompanied by severe and debilitating symptoms. C, is accompanied by a gradual decrease in menstrual periods. Or D, is accompanied by an increase in the estrogen and progesterone secretion. C, is accompanied by a gradual decrease in menstrual periods. Okay, good luck. Thanks for watching. Give me a thumbs up if you find this video helpful, and thanks for watching.